let's launch right into try to understand the pulses in relationship to fatigue, anxiety, and depression. And we'll take each pulse at a time, and then we'll talk about the herbs to fix that pulse. You're going to have a certain group of patients that will come to you that have the complaint of FAD, and they will be overweight, okay? And the overweight people are obvious. You don't have to think too much about it. And these type of people will always have a deep pulse. Now, what does a deep pulse mean? Remember, the Sun pulse should be mostly conspicuous in the superficial area. That's just below the skin. That pulse will be deeper. In other words, you won't find it at the superficial level. You'll find it at the middle or at depth. The Guam pulse, which should be in the middle, will be at the deep level, and the Chur pulse will still be at the deep level. That one might not change. But the Sun and Guam pulses will be deeper than they're supposed to be. So as soon as you put your fingers, and you can read both hands at the same time. You have to push down, way down, to find these people's pulses. Deep pulse means dampness, and deep means blood stasis. Okay, deep means dampness, and deep means blood stasis. So the people have too much water because the blood is not flowing very well through their system because they're too fat. Okay, it squished all the blood vessels. You have to look very carefully at the left Sun. The left Sun pulse, if it is weak, in other words, when you put your finger on it, it might be at the superficial level. It probably is not in an overweight person. It'll be deeper. But if it's deep and weak means you don't have to think too much about this. Weak is weak. I mean, if it's really pounding away at depth, then the heart pulse is not weak. But if you push down there and you find that the pulse is not felt very well at all, then that's a weak heart pulse. So, you can't just move the blood on these people. You have to also strengthen the heart. Because after all, it is the pump that's pushing or trying to push the blood through the squashed vessels. So the formula that you want to use is Fengji Wangshi Tong, which is a Huangqi-based formula. Huangqi is considered a tonic, but I find it's really a diuretic. Huangqi is very good for getting water out of the system. Huangqi will strengthen the heart, and the formula Fengji Wangshi Tong specifically gets water out of the body, especially the lower part of the body. These people who are overweight, that have these deep pulses, and who have fatigue, anxiety, and depression, will almost invariably, and a weak heart pulse, will almost invariably have swollen lower leg and ankle. And sometimes they'll say, oh, my lower leg's not swollen. Just take your thumb and push on the tibial bone on any one of their ankle area, and it can be a little bit above the ankle. It doesn't have to be at the ankle, a little bit above the ankle. Push on the tibial bone, and if you leave a dent in the skin, that's edema. And you can show them. You could say, look at your leg. See that? That's water retention. And why is there water retention? It's not so much a problem with the kidney. It's a problem with the heart and circulation. What's happening is that the blood is flowing down to the leg probably okay because it's flowing through the arterial system, and you got the force of gravity, which is just letting the blood go to the lower leg. But the only way the blood can get back to the heart is through the venous system, and the only way that can happen is through the power of the pumping of the heart. Because it's the power of the pumping of the heart that pushes the blood back through the veins to get reoxygenated in the blood. Well, if the heart is weak, if the pump's weak, then the blood hangs out too long in the lower leg. And since about 60% of the blood is water, plasma, then what happens is the water hangs out too long in the lower leg, and then the blood hangs out too long in the lower leg, and then the water content of the blood begins to seep out through the small venules of the leg. And the water gets into the interstitial tissue, and then there's this puffiness down there. So it's due to heart qi deficiency, with water retention and blood stasis. That is your diagnosis for these individuals who complain of fatigue, anxiety, and depression, who are overweight and have deep pulses. So the second portion of the formula, I call it Regeneration. I just made up that name. We make this formula at our clinic. And I put in a little bit more Chang in it to move the blood up and down the aorta a little bit better. And then I also put in a diuretic. I put in Bajingsan in there, because you can't just, once you start moving the blood around the body, you're going to make it possible for the body to eliminate a lot of toxicity that's been circulating around in a sluggish blood vessel system. And so you're going to finally give the body a chance to rid itself of a lot of inflammation and a lot of junk that's floating around in the blood. So you have to find a conduit to get that stuff out of the body. And the best way to do it is through the urinary tract. You could also get it out by pooping it out, but patients tend to complain of that. And of course there's vomiting, which the patients really complain about. So it's better to get it out through the pee-pee, okay? So all that regeneration formula works wonderfully well. If you give this to the patient, they'll come back in 2 weeks and say they're 50% better. And you come back in a month, they'll say they're 90% better. It's that dramatic. I mean, it's like magic.